With a growing population and an increasing spectrum of services, Meghalaya is intensively addressing problems and closing gaps to ensure quality health services for its citizens.
We as a facility, we had many challenges and issues which we faced as a team. Mainly it was regarding the infrastructure. So it's quite difficult for us to accommodate all the staffs and to provide quality services to the people, both in the OPD and in the IPD department.
The main challenges that come to my attention, starting from human resources, I found there was lack of trained manpower. And then due to paucity of funds, whenever an instrument goes out of order, we could not procure it quickly.
The improvements required include upgrading health infrastructure, ensuring availability of equipment, basic amenities, proper waste management, and all other enhancements to ensure better patient experience. This is where the Internal Performance Agreements, or IPAs, under the Meghalaya Health System Strengthening Project acts as a catalyst for improving quality health services across the state.
Internal Performance Agreement, which we also call as IPA, is from the family of results-based financing. The primary purpose of IPA is basically to create a autonomy at the health facility level and find a common thread starting from the health facility, which is at the lowest level, to the policy makers.
So in this project, the unique thing is that you fund the money to a certain entity within the health department based on their performance. Here we are decentralizing the resources, giving back to the facilities, but asking them to perform on certain indicators. So these are very non-negotiable indicators are there. Based on the level of performance, the money is released.
Internal performance agreements allow funding to flow directly to the health facilities. This reduces the waiting time for funding and allows improvements to happen faster, thereby benefiting more people. IPAs follow a decentralized approach to funding, allowing health facilities to gain funds based on their performance and giving them more decision-making power.
There is a process to check how this is going, and so that there will be process of assessment also, based on which the releases will be made.
Assessments are conducted on a periodic basis to measure the performances of the health entities. These assessments are carried out on the agreed frameworks and indicators in 3 stages: self-assessment by the entity, followed by ex-ante or external assessment by the assessment teams, and a third-party verification carried out by a third-party agency.
The project has defined certain measurable indicators in the IPA frameworks, which tries to cover both processes and outcomes across different areas such as quality assurance, infection control and waste management, patient and staff satisfaction, and even the state health priorities such as maternal and child health.
We had piloted it in 2 districts, in Riboy and West Garo Hills, where many of the facilities were onboarded along with the directorates here and the district medical health officers also. So each of the performances is linked to another, which means the health facilities performance is linked to the DMNH office performance, and the DMNH office performance also will be linked to the directorate's performance. So this is going to be very key. So everyone's performance is linked. So there is a system where each of them have to have a check and maker system within the system, so that everyone have a accountability here.
So the most important thing that we first learned about it was the convergence required from all the 3 directorates together with the state nodal agency MHS. So with that convergence came a lot of things that we could discuss in a common platform. And what we found out was the most important thing was there was a lot of duplication somewhere between some gray areas or thin red lines. There was some sort of duplication which was actually resulting in overload of work. So when we converged, we had subsequent meetings and all that. So what we managed was to, cut off these duplications. So that lessened the work. And then and as we are now, it's been in almost 8 months in implementation of IPA. So with the regular monthly meetings, and we also have regular meetings of the Joint Directorate Committee consisting of the 3 entities and SNA, MHIS. We have been able to find common ground, common objectives and common goals to go about our work and how to utilize the IPA funds that have been given to us.
And the best part of this fund is that it can be used and it can be utilized for whatever means they want. We have seen that many facilities in certain districts which have been rolled out, they have been able to get this fund that has been allotted to them, and they have been able to buy many things as per their needs. Some have been able to get the biomedical waste systems. Some have been able to buy beds, even bed linens. Some have been able to renovate their facilities. So in this way, each and everyone, according to their needs, they have been able to utilize the IPA or the Internal Performance Agreement.
So with this, then we started strengthening the laboratories, getting more equipment for it. We invested a lot in the small equipments, which although were not high-end equipments, but were necessary to get just the right amount of accuracy and precision in our tests.
As a facility, we did not have any standard treatment or procedures for the facility, but after the implementation of the IPA, we have formulated several SOPs for different departments, like for example, for BMW management, for ANC, care, for pharmacy and laboratory. So with the formulation of the SOPs, we are able to manage the cases better and to follow specific guidelines in providing services.
Ba kartu kani layo ka fund kani te menengkong ila haya arngut ki staff nurse na ka banta ka emergency te nang ta pade ngila pelut ya ka bat le kini ki street light te nang ta pade ngi penbiang ro ya ki staff ki don ke kartu kani ki kamera ki ba ngimbiang shu ki furniture mungkin ni ki shuki tengi ni thiet ni penbiang ki.
We have seen the positive impact of IPA funding in our programs, mostly involved and focused on maternal and child health, and as well as the registration of births and deaths in the state. I personally feel that we are very fortunate and we are very thankful for this support. And I know that at the end of this project, there will be many positive changes and there will be a huge improvement in the health delivery services of our state.
Now the facilities feel empowered because the funds are at their disposal and there is a lot of activities which they can do. So there is leadership which is cultivated, there is capacity which is cultivated, and but it is also at the same time accountability is created by a close monitoring system. This we hope will create a network of responsibilities and a network of accountability so that overall the services to the public is delivered in a very, very nice manner.
We are planning to cascade this quality management system down to not only to our district hospitals but to our community health centers and our primary health centers.
So this is a complete, it's a cycle. It's the entire ecosystem starting from the state level to the district level, and the health facility need to work in tandem in terms of understanding the spirit of IPA and keep spending the money and utilize it for the right purpose.